Some illnesses are obvious, but others can quietly turn your whole world upside down, often in ways that are really hard to spot at first. That's Lyme disease. Today, we're going to break down the 6 key ways this tricky condition can impact your well-being, from the very first subtle signs to the more serious stuff. So, let's get right into it. But first, I've got a question for you. Think about all the diseases that get spread by insects and other little critters, what scientists call vector-borne diseases. Which one do you think is the absolute most common right here in the United States? Go ahead, take a guess. If you were thinking Lyme disease, you nailed it. This infection has a nickname, the Great Imitator, and for good reason. Its symptoms can look like a dozen other illnesses, and the really tough part? Its effects can stick around for years, making it a serious challenge for anyone dealing with it. So let's start at the very beginning. Lyme disease is kind of a stealthy threat, and it all kicks off with something incredibly small and super easy to miss, a tiny tick bite. So what is it exactly? Well, Lyme is caused by a type of bacteria called Borrelia burgdorferi, and here's the crucial part. You can't catch it from another person. The only way it's transmitted is through the bite of an infected black-legged tick. That's it. All right, the first real signs of trouble usually pop up within a month of a bite. Now, this early window is absolutely critical. Seriously, catching the disease right here can make a world of difference in how well treatment works. The thing is, these first symptoms are so misleading. You've got fever, chills, fatigue, body aches. It sounds exactly like a bad case of the flu, right? And that's precisely why it gets missed so often in those early days. But there is one classic sign that a lot of people have heard of. It's a very specific kind of rash. The official name is erythema migrans, but you probably know it as the famous bullseye rash. Now, check this out because this is so important. Even though that bullseye rash is the classic symptom, it only shows up in about 70 to 80% of people. That means a huge chunk of people, up to 30%, get infected and never ever see that rash. You just can't count on it. For the people who do get it, it usually shows up about a week after the bite. And we're not talking about a little dot here. This thing can spread out to be a foot wide. And get this, it doesn't always show up where the tick bit you. It can appear anywhere on your body. So how does all this mess with your life right away? Well, for one, just trying to work or do daily stuff when you feel like you have the flu is incredibly hard. 2, the risk of getting it wrong is high. You think it's just a cold, but cold medicine won't do a thing for a bacterial infection. And finally, having a big, visible rash can be pretty stressful and can really knock your self-confidence. But what happens if that early stage gets missed? If it's left untreated, the infection doesn't just pack up and leave. Nope, it digs in and progresses, and that can lead to much more serious long-term problems. Yeah, the disease really ramps up. What starts out as feeling kind of miserable and flu-like can morph into these severe, targeted problems that go after your joints and even your nervous system. The impact on your body becomes way more intense and debilitating. And these later symptoms are all over the place. We're talking severe headaches, arthritis that's so bad your joints swell up, and nerve pain that can feel like shooting pains or numbness in your hands and feet. One of the most recognizable ones is facial palsy, where one side of your face starts to droop. And it's not just physical. The effects on your mind can be just as tough to deal with. This brain fog people talk about, it's not just feeling a little spaced out. It's a real cognitive disruption that can make it feel almost impossible to focus on your work. So the hit to your well-being just gets bigger. Brain fog makes it hard to do your job. Chronic pain can make something as simple as exercise totally out of the question, so your overall health declines. And this is a big one. The psychological symptoms that can come with Lyme are often mistaken for something else, meaning people get treatments that don't even touch the real cause. Okay, I know that all sounds pretty grim, but it's not all bad news. With the right diagnosis and care, there is absolutely a path to getting better. So let's talk about how Lyme disease is actually treated. The single most important thing for a good outcome is time. I can't say it enough. Early detection is everything. When Lyme is caught in those first few weeks, a simple course of antibiotics is usually enough to knock out the infection and prevent all those long-term problems. However, and this is a big however, even with treatment, some people end up with something called post-treatment Lyme disease syndrome. This is where symptoms like fatigue, pain, and brain fog can stick around for months or even years after the bacteria are gone. It can make recovery a much, much longer road. So what's the big takeaway from all this? Well, it really comes down to a simple plan of action. First, know the symptoms. Just be aware of the signs, especially if you've been in grassy or wooded areas. Second, if you have any of those symptoms, don't wait around. Call a doctor and get tested. And third, everyone's experience with this is different, so work with a doctor to get a treatment plan that's made just for you. And that brings us to our final and maybe most important point. Lyme disease is a master of disguise. Its early symptoms can so easily hide in plain sight. So what's the single best tool we have to protect ourselves? It's awareness, plain and simple. Knowing the signs and acting fast is truly the key. Thanks so much for tuning in.